This is a soft cataract. In fact, it is just an anterior capsular cataract. There's no other opacity in the lens. And so here, after making the initial incisions, both the main port as well as the side port incisions, I go ahead, fill the anterior chamber with HPMC. I put some over the cornea as well. Most of this, the main part is actually totally unedited. So, and initiating the rexus. So, using my usual method of bent 26 gauge needle, since there is hardly any support for this capsule, the underlying cortex is extremely soft, so it takes a little more pressure on your part to guide this rexus around. You literally have to dig into that capsule and make it go on its way. Yeah, that's rexus around 5 mm, maybe a little less, but it's adequate, more than adequate. So once the rexus has been done, I go ahead with the hydrodissection. Sometimes you just don't get it to you, and then third time lucky, and that's it. Since it's such a soft cataract, I'm going to do my pole prolapse method and just press on the other side, and that's it. And you can rotate this. You don't need a huge rexus to bring out these soft cataracts. So I then just put some HPMC over the cataract, and I'm going with my dialer in my left hand and the Phaco probe in the right, and essentially this is going to come, see, just with vacuum itself, it's punching in holes. I'm just trying to get a hold of it and zap it a bit. This is all vacuum only, just getting that, and that's it. Just see how fast, it's less than a second. And then rather than changing to my IA, decide, let's take out the cortex with the Phaco tip itself. Of course, I have stepped down my parameters. Now my parameters are just 200 vacuum and 20 ml flow rate. Initially it was 400 vacuum and 40 ml aspiration flow rate. And you can see, once you have the cortical fibers protruding out of the anterior rexus, you can always get a bunch of it, occlude your Phaco tip and strip the cortex towards the center. Don't try to take individual fibers, very difficult to do that with such a large pore. And that's it, everything is out, looks good. Unfortunately, I have to put in HPMC because I am going to implant a single piece PMMA tipped hydrophobic foldable IOL, which comes in a pre-filled cartridge system, and it's the corkscrewing type, so you need both hands to deliver this lens into the bag. So there's no way I can do a hydro implantation here, or else that would have saved much more time. And since I have put in HPMC, I'll have to take it out as well. Take it out both in front and behind the IOL. And once that's done, I put in my intracameral antibiotic. just check my wounds, hydrate them if necessary, and conclude the surgery. Thank you so much for watching.